Hello everyone, welcome to our Facebook Live session. Today we have with us Dr. Krishnamani, consultant medical oncologist from American Oncology Institute, Naladeville, Hyderabad. Today being World Lung Cancer Day, let us know a few details about the advanced lung cancer management and treatment options. So doctor, I would like to know what exactly is lung cancer and when is it called advanced lung cancer?
So, to put it very simply, cancer which starts in the lung is lung cancer. And it is one of the most common cancers we see today. So, advanced lung cancer is a cancer which has spread beyond the lung. So, in layman terms, what people usually say is stage 4 cancer. So, yes, stage 4 cancer is advanced lung cancer. So, cancer which starts in the lung and which has spread to other parts of the body is advanced lung cancer. And where does it commonly spread? It spreads from one lung to the opposite lung, or it could spread to the brain, or to the bone, to the liver, or any other structure. Okay. So, a cancer which starts in the lung is lung cancer, and an advanced lung cancer is a cancer which has spread beyond the lung.
Right, sir. Doctor, could you also tell us how is this advanced lung cancer diagnosed?
So, if you diagnose any cancer, the first thing what we should understand is cancer is diagnosed always or mostly on a tissue. So, tissue is a piece of the tumor being sent to the lab, and this process is called a biopsy. So, to diagnose, so to put it simply, tissue is the issue. Okay. So, you will do a biopsy, you will take a part of the tissue, send it to the lab, and then your pathologist will say, there are cancer cells, and then the cancer is diagnosed. Number one. Number two, you also are going to stage the cancer or see where all the disease has spread.
Right.
So diagnosis is not only getting a diagnosis of lung cancer, it's also diagnosing the stage of lung cancer by doing maybe a CT scan or a PET scan or a bone scan or an MRI of the brain, etc. Now, a biopsy need not always be done from the lung. Because I have lung cancer, you need not do a biopsy from the lung. Biopsy will be done from the most easily accessible area.
Right.
So a lung cancer patient who has a lymph node, biopsy can be done here. Or if it has spread to the liver, it's easily done from the liver than the lung. Okay. So to diagnose a lung cancer, you need a biopsy and a tissue, number one, and you would do scans to stage the patient.
Doctor, is the advanced lung cancer a serious condition?
So the term itself is advanced. That means it is not curable. So, by cure means your disease disappears and it should never come back. So, with advanced lung cancer, with advanced cancers of most types, you're technically not talking about cure. What you're trying to do is reduce the burden of the disease, improve the symptoms of the patient, improve the quality of life, and prolong their lifespan. So, yes, it is serious. Some patients may present in a very, very advanced stage where they are extremely breathless, unable to even walk 2 steps. So in those set of patients, there is nothing much you can do, or they may, so the disease is really, really advanced. But the other patients, yes, it may be stage 4, but they may be stable and they may walk into your room. So you have enough time to diagnose, to stage, start treatment, and obviously they will have a better outcome. So yes, it is serious, but how serious depends on the general condition of the patient, the comorbidities in the form of sugar, diabetes, heart issues, right, those kind of things. And also how much of the cancer you have got, whether it is spread to too many areas or it is spread to one or few areas.
Right. Doctor, could you enlighten us about the different treatment options that are available for this advanced lung cancer?
So for advanced lung cancer, most of the treatment is going to be systemic treatment. Systemic treatment is a treatment which works all over the body. So we are not going to talk about surgery here, because that is done for the early stages. Right. So what are the treatments for advanced lung cancer? The mainstay is always chemotherapy. So chemotherapy is a medicine or a cancer killing drug, right, to be very simple. So it controls the cancer or kills the cancer cells to achieve our objective. So chemotherapy is one of the treatment options. Immunotherapy is a new treatment option in advanced lung cancer, where in some patients can get away from chemotherapy and do only immunotherapy. Targeted therapy in the form of what we call as monoclonal antibodies is one option, which we add to the chemotherapy. And fourth, tyrosine kinase inhibitors, or these are tablets which the patients can take in certain forms of advanced lung cancer, these kind of patients who have few mutations, they need not take chemotherapy, they will benefit from tablets. Okay. So broadly, chemotherapy, immunotherapy, targeted therapy, and tyrosine kinase inhibitors are tablets.
Doctor, could you let us know about the immunotherapy in lung cancer?
So immunotherapy is a new treatment which is being effectively used in most cancers in the last 10 years. So starting from melanoma, which is a type of skin cancer, and we're using it in multiple cancers, including lung cancer. So what immunotherapy basically is, it's a drug which effectively boosts your immunity to kill the cancer. Okay. So in lung cancer, you use in certain patients. So we do certain tests on the tumor. For example, PD-L1, MSI, TMB, etc. More importantly, PD-L1. So this is nothing. On the tumor, there is a test which is done in the lab. And if you have a high score of PD-L1 above 50%, then you can be given immunotherapy alone. Mm-hmm. If your score is between 1 to 50, you can be given immunotherapy with chemotherapy. Right. This is in first line. Mm-hmm. So advanced lung cancer patients who come to your clinic, if you want to start them on treatment, if they have a high PD-L1, only immunotherapy is an option. If the PD-L1 is low, immuno plus chemo is an option. Right. And what is it? It's a drug which boosts your immunity to kill the cancer. Okay. It differs from your regular chemotherapy. Regular chemotherapy is painful. Regular chemotherapy can cause a lot of side effects, hair loss, vomiting, nausea. Regular chemotherapy can have a problem with your fallen WBC counts, your hemoglobin, infections. And regular chemotherapy is given for a fixed number of cycles, like 4 or 6 cycles. You can't go beyond it. Right. Immunotherapy is usually, if somebody is tolerating, you can do it up to a maximum of 2 years. It has none of these chemo side effects, though it has a different set of side effects. So it is fairly well tolerated. So in all those parameters, immunotherapy scores over chemotherapy if the patient is eligible for immunotherapy.
Doctor, could you also let us know how is this advanced lung cancer different from a smoker and a non-smoker?
So the thing is, for this we should first know what are the causes of lung cancer. Earlier, the most common thing which used to be told was lung cancer is seen in smokers. That is not true now. So out of 10 patients, maybe 4 patients could be non-smokers, could be women or men who do not smoke. And they have a particular type of lung cancer called adenocarcinoma. So lung cancer is equal to smoking is not the rule now. Okay. That doesn't mean we can smoke and we can get away. Smokers will have lung cancer as the predominant percentage. But non-smokers do develop lung cancer. So out of 10, at least 3 or 4 will be non-smokers. And the cancer, the way it behaves differs in both these people. So, and that too in the advanced cancer. So what research has taught us is, the advanced cancer patients, on the tumor we do certain set of mutations which we just discussed. These are called EGFR, ALK, ROS, etc. The chance of these mutations coming positive is very high in a non-smoker compared to a smoker. So if you have 100 smokers and 100 non-smokers, and you run that tumor of all these people for these mutations, maybe less than 10 people in the smokers group will have this, more than 60 or 70 will have it in the non-smoker group. Okay. So how does it matter? It matters because anybody who is positive for these mutations can avoid chemotherapy and be put on tablets which we just discussed. Right. So in the non-smoker group, you have a large number of patients, almost 6 to 7 times the number, who are eligible for tablets and who can get away with chemotherapy at least initially. Right. And the tablets work better than chemo. The tablets are more targeted, more personalized. These patients need not come to hospital every 3-4 weeks to take chemo drips and have the side effects. They can take the pill at home daily. They'll do much better than chemo patients, and their survival is much, much longer than the smokers. And smokers' lung is anyway damaged due to chronic obstructive airway disease and other things. So non-smoker has an advantage that his lung is also good, and he also has the advantage that there is a high chance of them being mutation positive and getting tablets. Otherwise, these guys or the smokers, unfortunately, will have to be put on chemo and only chemo.
Right. Quite surprising information about the smokers and the non-smokers. Thank you, Doctor. Doctor, could you finally conclude by giving us few key takeaways about the advanced lung cancer?
So the key takeaways on lung cancer is very common, number 1. Number 2, it's seen both in men and women. Number 3, it is seen both in smokers and non-smokers. The prevalence in non-smokers is actually increasing. Number 4, majority of the lung cancers are still seen in the advanced stage, that is stage 3 and stage 4. Advanced lung cancers, the prognosis has definitely improved over the last 1 decade. And it is more personalized now. Especially in smokers and women who have adenocarcinomas, check for mutations. They will be eligible for tablets or tyrosine kinase inhibitors. We are moving away from chemotherapy towards TKIs or tyrosine kinase inhibitors and immunotherapy. The last 10 years or 1 decade, immunotherapy has played a big role in most cancers, including lung cancer. And a disease which was dreaded maybe 10-15 years back with limited survival, now we are in certain subsets, we are looking at survivals of patients more than 3 years or even more than 5 years with good quality of life.
Understood.
And more importantly, quit smoking.
That's very nice. Yeah. Viewers, I request all of you to please follow whatever our doctor has informed and try to quit smoking and have a good life. Thank you.